Did you know from the 1930s to the 1950s, cigarettes were once physicians tested and approved? Today, however, we know cigarette smoking kills more than 480,000 Americans each year, and more than 41,000 of these deaths are from exposure to secondhand smoke. Smokers are at much greater risk for cardiovascular disease, which includes stroke and coronary heart disease, and are conditions that affect the heart and blood vessels. Damage to the blood vessels can cause them to thicken and grow narrower, which as a result can make the heart beat faster and your blood pressure go up. Clots may also form, which can result in the smoke due to the blocked blood flow to the brain.
Smoking can also lead to lung diseases by damaging your airways and the small air sacs found in your lungs. The lung diseases and respiratory diseases include COPD, emphysema, and chronic bronchitis. In most cases lead to lung cancer. If you have asthma, smoking can lead to even worse attacks or make you have more frequent attacks. It can also lead to cancer that can occur almost anywhere in your body, from the bladder, the blood, the colon, your kidneys, your livers, the cervix, parts of your throat, tongue, tonsils, your pancreas, the stomach, and the lungs. Smoking can also lead to increased risk of dying in cancer patients and cancer survivors. If no one was to smoke a cigarette, 1 out of 3 cancer deaths in the United States would not happen.
There are other common health risks associated with smoking. Most women, it affects their pregnancy and also the baby's health. This in terms can be preterm delivery, stillbirth, which means the death of a baby before it's even born, low birth weight, and also sudden infant death syndrome, also known as SIDS, the cleft lips in infants, and not only women, but also affects the men. In sperm, it can reduce the fertility, birth defects, and miscarriages. It also has to do with bone health as well. Women past childbearing years who smoke have weaker bones than women who have never smoked. And it also has a greater risk for broken bones, and includes health of teeth and gums and results in tooth loss. Other common ones are cataracts, which are clouding eyelids. Type 2 diabetes is actually a really big one. It's harder to control. Also, you're going to have a risk of 30 to 40% higher, and your general adverse effects on the body is going to be major because it will damage all of your organs, including inflammation and decreased immune function.
Human system, the chemicals in cigarette smoke are an ongoing source of damage to cells throughout the body, and your human system must continually work to fight off this damage. Eventually, the human system cannot keep up with all the damage caused by the smoke, and the smoking also causes inflammation in area related to your human system, which is caused your system to be less effective in fighting all types of infection, such as the flu, pneumonia, and any bacteria and virus that may attack the body.
Many people understand the harmful effects of smoking, but wonder if there are any health benefits to quitting, and the answer is yes. And they start almost immediately. Here are just a few of those benefits. After 20 minutes of quitting, blood pressure and your pulse will return to normal. After 8 hours, nicotine and carbon monoxide levels in the blood are halved and oxygen levels return to normal. After 24 hours, carbon monoxide levels in the body is eliminated and your lungs finally start to get all the tar out of them. 48 hours, there is no nicotine left in the body. Your taste and smell will finally start to get normalized. 72 hours later, your breathing is going to become much easier and your bronchial tubes begin to finally relax, along with your energy levels increase. Within 3 to 9 months after quitting, you quit coughing, wheezing, your breathing problems will improve due to your lungs having up to 10% more oxygen. After 1 year, your risk of heart attack is cut in half. After 10 years, your risk of heart attack is now the same as those of non-smokers. Medium to long-term quitting, the risk of developing lung cancer, other cancers, heart attack, stroke, and chronic lung diseases is reduced. The sooner you stop smoking, the sooner your risks go down, and you can avoid all these harmful chemicals. Hotlines for quitting. For help with quitting smoking, you can call the Arkansas Tobacco Hotline at 1-800-QUIT-NOW. That's 1-800-784-8669. It's confidential, one-on-one, personalized help just for you. There's a 24-hour direct line to professionally trained quit coaches who want to help you fight in the fight to quit smoking. 24-hour hotline community of support from others who've also gone through the same thing and have tried the challenge of quit smoking. Free text messaging program also, and there's also a smartphone mobile app. Help with your free nicotine replacement therapies such as gum, patches, and lozenges. That's only while supplies last though, so call us.
We touched on the topic in our introduction about secondhand smoking, but we never really elaborated on exactly what it was and how it affects a person. So, as we previously stated, more than 41,000 people had died from exposure of secondhand smoke. It is obvious health risk to those who, not only the smokers, but those who are around people who do smoke. So, as for this first slide, we wanted to define what exactly is secondhand smoke. There are 3 characteristics. First, we're looking at the burning of tobacco products. This includes cigarettes, cigars, or even pipes. Second, we also want to include the exhaled smoke that the person gives off when they are smoking. So not only is the person smoking at risk, but the person who inhales this smoke is also at risk. The third one we want to include is more than 7,000 chemicals can be found in tobacco smoke, and even about 70 of those contain cancerous agents. So if you don't even die of heart disease or a stroke, you could die of cancer. This is an important concept. The depressing factor is that there are no risk-free level of secondhand smoking because anywhere you go, people smoke. So it's really hard to do a no risk-free type trial. It also is occurred that even if you are around smoking, someone smoking for a short period of time, that's still going to do some damage to your body, whether it's breathing in just literally one breath. That's how toxic these chemicals are in tobacco products, such as cigarettes. So as the second slide goes, we also want to touch on the effects of secondhand smoking on children and adults. So as for children, we're going to look at ear infections, more frequent and severe asthma attacks, which also includes the contracting of asthma attacks for children. Frequent and severe asthma attacks, which also includes the contracting of asthma attacks for children. Maybe they weren't having asthma, but then they became around someone who was smoking and then they contracted it. That is an important factor to know. Another case for effects is respiratory signs and symptoms, which could be coughing, sneezing, even shortness of breath. Then we're also going to look at the respiratory infections, which can include bronchitis and pneumonia. Even those diseases, if they get severe enough, can cause death or even damage to a child's body. As for adults go, heart disease is one effect. For non-smokers, breathing secondhand smoke has immediate harmful effects on the heart and even the blood vessels. This can be proven in a research study that the CDC reported. In 2005 to 2009, there were 34,000 cases of heart disease deaths in the U.S. As for that same case study, lung cancer played an important role and is also a health risk for adults in secondhand smoking. In that study, 7,300 lung cancer deaths were reported in 2005 to 2009 in the U.S., and that study was by the CDC. The stroke also contains several harmful effects, and it stands at great risk for the exposure of secondhand smoke. So as a review, as you can see, even these effects that secondhand smoke has on a non-smoker actually assimilates to those effects that smoking has on a regular smoker. So who is at greater risk here? As for prevention methods go, there's not really much you can do as far as going out in public and going somewhere where smoke-free laws occur, because a lot of those places haven't come in contact except for like restaurants. But what you can do is keep your children and yourself away from people who smoke in public, and even put your home at a smoke-free type, I guess, rule you could say. So that's it.
Causes many diseases and reduce the health of smokers in general. Quitting smoking lowers your risk for smoking-related disease and can add years to your life. Remember that the next time you pick up a cigarette.